We are recording today's webinar, so if for some reason you had to hop off due to something coming up on the work front, you can always log on to our website and watch the webinar at a later date, or if there's someone else in your organization that wasn't able to join us today, they'll be able to access it through our Leslie Group website, and it will be posted on there next week. We do like our webinars to be interactive. So the information shared today is really to try to help you understand problems that exist out there and how different solutions can help your organization. So if you do have questions throughout the webinar, just type them in the question box and I'll be monitoring it throughout both the sessions today with our two guest speakers. I had the pleasure of hearing both our guest speakers present at a Best Doctors Conference in Miami in February of 2019, and they're fantastic. So the next hour will be time well spent. A lot has changed in our world since February 2019. And although back then we were talking about the challenges in the Canadian healthcare system, both from an access and a technology standpoint, both of those things have actually gotten worse during COVID. So those problems exist and are actually even a bigger problem today than they were back then. So during today's presentation, we'll discuss how the Canadian healthcare system has changed over the years, both pre-COVID and during COVID. In addition, we'll discuss how there's 13 different healthcare systems in Canada, not one, so we're lacking uniformity. We'll also discuss how two main healthcare problems are impacting Canadians. So both medical wait times and difficult access to the best medical technology available in the world. The good news is we aren't going to just talk about problems, we're also going to talk about solutions. One of the challenges that organizations have is if you have a key person in your organization that isn't able to get access either in a timely manner or can't get proper access to medical technology, that impacts the organization because they're unable to work. So we're going to talk about solutions on how you can help executives and key people in your organization get access. So our two guest speakers today, our first one is Alan Wearmouth, and he's with Medcan. Alan's been with Medcan for over 5 years and manages the corporate sales and account management team, where he partners with sponsors to develop and implement health and wellness programs to support organizations and people's strategies. He'll be recapping Medcan's core solutions and associated benefits to sponsors, both from an ROI and VOI perspective, specifically the annual health assessment relative to Best Doctors. Medcan's core corporate solutions include the annual health assessment, year-round care membership, as well as genetics, including pharmacogenetics, cardiac panel, or cancer panel. He'll touch on trends that Medcan is observing in the makeup of the sponsored programs and how they help consult on future people strategies. Our second guest speaker today is Deep Bajwa with Best Doctors. Deep is an innovative, forward-thinking executive with nearly a decade of experience in the insurance, health, and executive benefit management industries. His consultative leadership style has inspired local and national teams of sales and marketing executives to achieve outstanding results. As the Director of Sales and Business Development with Best Doctors Insurance Canada, Deep oversees the sales and marketing initiatives in 10 provinces and 3 territories across the country. So at this stage, I will turn it over to Alan.
Thank you, Allison. Good morning, everyone, and thanks for taking the time to join us today. I am going to be talking a little bit about Medcan's core solutions, and feel free to jump in at any time and join me in the discussion. There's no need to hold off until the end. Like Allison said, she's going to be fielding questions that you type into the message box there. So I'll get right into it here. So Medcan's been around for over 30 years, Toronto-centric company. We have a purpose-built philosophy of living well for life, yes. Eat, move, and think are our principal philosophies, and our solution orientation has to do with the mind, the body, and the medical, and the integration of the three. At Medcan's core, what we're able to do is really support everyone within an organization, from those that are healthy and training for marathons to individuals that could be at risk, and even those that are chronic. The core of what Medcan does, and really the start of Medcan came about because of the annual health assessment. So this is a solution that is both proactive and preventative, and something that is not really available in our wonderful healthcare system in Canada, any one of the 13 really. And it's really meant to support keeping healthy people healthy. The assessment itself is a single-day solution. It is available nationally through a strategic network of partners. You would, as a patient, come into the clinic. You'd spend roughly 5 to 6 hours going through 12 to 15 diagnostic medical exams. At the end of your day, you have a great outlook on your current health state. And in Toronto, we're able to provide real-time results. We own the blood and urine lab. We employ the radiologists. We have the imaging equipment on site. And that's a core of our value proposition. Knowing how busy people are, it's important for us to be able to resolve the conversation in one go. Negatively trending markers are intercepted and discussed on site and in real time. And then our referral team activates immediately to try and find the best possible solution for the patient if a matter has to be escalated or further investigated. Here's a quick breakdown of what the day might look like for an average patient. It includes gender and age specific testing. So things like mammograms, transvaginal ultrasounds, bone and mineral density tests, would all be added to the day at no cost, but we're not looking to do things that are unnecessary. So if somebody just recently had one of these tests, as quickly as they're opted in, they can be opted out. There's also a mind station that's included in the day. So speaking to the mind portion of the mind, body, and the medical, it's important in a proactive way to try and intercept any possible mental health risks that a patient may be displaying. In terms of now, that was the proactive and preventative. In terms of the reactive and the episodic, we also have something called year-round care. Year-round care is really meant to be a 365-day membership style support system for a client. And the way that this works is really simple. It's by appointment. It is not on an ad hoc basis. We understand that people are busy. We also understand, especially in the virtual world, that instead of flybys and discussions midday, a lot of our calendars are booked up with meetings because that's just the way that the world has shifted. And because of that, it's more important than ever to be able to schedule your day. So if you wake up in the morning, you don't feel well, and you know you have a gap at 1 o'clock, you can call in, make an appointment, and visit virtually with and consult with a physician to try and work towards a resolution for whatever's ailing you. That could be anything from musculoskeletal to mental health to coughs, colds, flus, and heaven forbid, anything COVID related. Because it is a virtual consultation, there are, of course, limitations, and we're able to work through those. But we have a 90% success rate with these virtual calls and work towards a resolution. And just like with the annual health assessment, all of your records are kept within our ecosystem. So they're made available to patients, which is a huge pain point in any one of our 13 healthcare systems. Access to those records is always made available through an online platform to our patients. The full circle of care also includes things like referrals, national prescription delivery service, so next day to any Canadian address, and that's sent out. And of course, there is the digital side to this, but there is also the in-person side to it. So we do have the clinic that's been open throughout the pandemic. And will not close if there are any future downturns in the economy or in our healthcare system. The only things that were really impacted in the 2020 closures were things that are non-medically necessary, right? So anything cosmetic, for instance, would have gone offline, but things like the assessment and things like our year-round care clinic have been open throughout. So the before, during, and the after, so online appointment bookings and being able to book over the telephone during the one-on-one secure consultation with our physicians, and then after, centralized patient support care, ongoing assistance, and then the digital platform where you're able to connect with us and your records and any number of your outcomes. The third part to our core corporate competencies is genetics testing. We have a very robust genetics program at Medcan, but we've really honed in and reduced the scope to just 3 tests at this time that we feel not only the patients, but sponsors get the most out of. That includes cardiac testing, cancer testing, and something called pharmacogenomics. So cardiac and cancer testing, very straightforward stuff. It's your genetic susceptibility to either cardiac or cancer risk. The cancer is we're able to hone in on the kind of cancer it is. So it's not generalized. It is in fact very specific and has an application to your ongoing healthcare journey. Not meant to be a scare tactic either. The idea behind all of this is to arm the patient with the information necessary to have their best interest in mind and make sure that they're on their way with their health journey. So it may result in screenings starting earlier in life or more frequent screenings for whatever the ailment or the potential ailment might be. Does not impact insurability, as we know here in Canada, genetic testing, because you do not have the symptoms and the ailment, you just have the possible susceptibility to it. It will not impact insurability for individuals. So that's great to know as well. And then pharmacogenomics is the third of the 3. And pharmacogenomics is meant to provide individuals with a study of how their body metabolizes different substances. So everything from caffeine to morphine, it's a panel of over 200 substances and how their bodies react to it. So, a real world example of something of the utilization of something like that might be a 12-hour slow release Tylenol tablet. Are you metabolizing that as intended and seeing relief over a 12-hour period? Or is the individual's body metabolizing that too quickly? It's through their system in 3 hours, and unbeknownst to them, they're just in discomfort for the next 9 before they re-up. And on the other side of the coin, metabolizing it too slowly. You re-up at the 12-hour mark. Let's say it stays in your system for 36. You could have a triple dose in your system at any given time. Of course, no cause for concern with something like Tylenol, but if you apply that same framework to mental health medication, painkillers, blood thinners, and so forth, you can imagine the kinds of adverse side effects that patients feel. And in our medical system here in Canada, we do deploy the trial and error method at large. So physicians just prescribe the most popular medication for a given circumstance at any particular moment. And if it doesn't work for you, take 2, call me in the morning. We'll wean you off that and try the next best thing. Arming your physicians with information that is specific to you and your healthcare journey is vital for them to make the best possible decisions about your healthcare journey. The start of this really has to do with you sitting with a genetic counselor as well. So it's not arbitrary. A patient isn't just picking one or another at random and having that testing done. We make sure we have a conversation both before and after to apply context. So in advance, the genetic counselor will ask leading questions. Do you have family history? Do you have any cause for concern? Why did you choose this test? And through that conversation, if it's discovered that one of those 3 is more poignant or more applicable to a given client, they'll make a thoughtful recommendation that the client pursue that avenue at this time. Through the corporate programs, we do suggest that only 1 test be sponsored per year, but sponsors are able to choose 2 of the 3 or all 3 of the 3 in the first year. And after that, there's no need to do them once again. And again, all of this information is housed at Medcan, and we're able to report out on this to both clients and sponsors in the end. Analytics. So this ties in really nicely to the information portion of things. I love this slide. So it shows the quality of healthcare over a time continuum and how small adjustments in your routine or in your habits today can have enormous impacts downstream, both positive and negative. And being able to intercept those negative trends in your healthcare today may only require a small change to make a huge difference down the road for you. So after your first assessment, you're going to be given, thoughtful consultation on what your next year might look like. After your second, third, and fourth assessment at Medcan over a period of time, we're able to now start seeing trends in your health, both positive and negative, at the micro and at the macro, for your healthcare journey, and really make thoughtful suggestions as to where you are heading in that regard. So, we can say that if you continue these habits, you could be leading down the road to diabetes, to obesity. You could be leading down the road to any number of things that we can curb today and make sure that your tomorrow is better. That also goes for sponsors. So as we think about our benefits programs for sponsors and the cost increases year over year, and the information that we're providing to them to make material changes to their people strategies, I think this could be at the core of that. There are, of course, utilization minimums that are required in order for us to divulge this kind of information, in order to not step over any privacy boundaries, but they're very reasonable, and we're able to provide that information up front to both brokers and sponsors. It's roughly 40 lives that the utilization for our programs. The analytics result have 5 major impacts to a program. So improve patient care, absolutely. And this is where you start seeing the ROI and the VOI. So for every dollar spent, the Sanofi surveys over the years have always suggested that you're going to save $3 on the back end, right? So for every dollar you put into a proactive healthcare program, you're going to save $3 down the road. Increase drug effectiveness through things like pharmacogenomics, for instance. So we make sure that patients are on the right drugs at any given time, whether that's on label or off label, and saving them and their benefits programs money. Prevent unintended interactions between drugs. So with comorbidities and individuals that are consuming multiple drugs or very expensive drugs, you want to make sure that the interactions between those drugs, not just between the drugs and the individual, are also taken into consideration. And it's so important to have one entity quarterbacking all of that on behalf of a patient. And Medcan is able to stand in and do that through our membership services. Improve medical compliance and improve economic efficiency on benefit programs. So I'm preaching to the choir here when I say stuff like that, but that's the ultimate goal, to make sure that both the sponsor and the patients are seeing the benefit to these programs. This sort of rounds out the presentation that I had formulated for everybody, and I tried to move it through it quite quickly. There are a couple of other things that are worth mentioning that Medcan is able to provide at this time, especially as we start thinking about return to work strategies and what that might look like. The in-person return to work specifically, not virtual as we have been doing. We are able to provide nursing support, antigen testing, and PCR testing. I can speak to when we had the color-coded systems under the gray, the Ontario healthcare system and the federal system had suggested that anyone who was working on site be tested twice a week. Just for instance, as we're moving towards a fall, the potential of a fourth wave and so forth, I think it's important to sort of keep that range in mind. And if you're going to be working on site, it's always a wonderful opportunity to have a third partner, an entity to come into your office and help you on that level. It takes away from things like liability and having to manage that with limited resources. And also allows us to collect that information on behalf of the sponsor and then report out on it over a period of time. And then marrying very nicely with that is our consulting arm. So Medcan has employed world-class physicians for over 30 years. Our current chief medical officer, Dr. Peter Nord, and individuals like Dr. Elaine Soto, who's been the chief medical advisor to the TTC in Toronto for over 20 years. So you're talking about decades worth of business experience and decades worth of physician experience marrying into a program where we're able to help consult companies on how to manage their people strategies, how to help create their pandemic response Bibles, how to help them provide resources to their employees. So we're really arming the people leaders within an organization with a resource that they can turn to and say, I'm not armed to answer these questions, but I have a resource that is, and we can certainly help make the employees feel good, and therefore by extension their families, because we know that these are troubling times, and if somebody from the family has to go into work, it impacts the entire family, not just the individual. These same physicians are able to appear on fireside chats and webinars, but specifically creating strategy at a high level with the executives within an organization. This consulting arm works on a retainer style model. It is very palatable. It starts at $13,000, underlining value of about $850 an hour, roughly 15 hours. At that minimum level, we're able to improve on the prices as retainers get larger. And we've seen a tremendous amount of interest in this area during the pandemic. I thank you all for your time. More than happy to answer any questions anybody might have. Allison and anybody write in?
Nothing so far, but we'll have a little bit of time at the end as well. So if anything does come up, we can always circle back. But Alan, just one quick question that maybe you can chat about the national reach of Medcan. I know you guys are based out of Toronto. We've got people joining us today across the country. I myself, I'm in Alberta, but I know we've got people from all the way from BC to Ontario. So maybe you can just touch on that before we turn things over to Deep.
Absolutely, and it's a great question. So Medcan is in fact Toronto-centric. We're opening up our second location in Oakville right now, which is just arm's reach from Toronto. The idea is that they're close enough that we can hold their hand, and once we have that those operational processes down, we can just cut and paste, and then we're looking at other hubs like Montreal, Calgary, and Vancouver in terms of producing our more Medcan clinics. For the time being, what we do is we have a national affiliate network that covers almost every major city in Canada, all of the capital cities within provinces across Canada, providing the annual health assessment in different parts of the nation. In terms of year-round care, it is predominantly virtual, especially during the pandemic, as people don't want to expose themselves and are looking for a more immediate solution. And therefore, that's able to be national on the virtual level. So individuals are able to connect with us for those episodic symptoms that they might encounter throughout the year. Again, our prescription delivery model, also national. So that's been wonderful. Things like genetic testing. We do have kits that we can mail out to people's homes. So if we have a participant in either Calgary or Vancouver or any city across the nation, we are able to connect them with that service virtually and just mail it back. And it's as easy as a quick saliva swab for them. But during the pandemic, especially, it's exacerbated the need for virtual solutions. Individuals and sponsors alike are hoping not to expose themselves wherever possible, and we've really had to build that out significantly. Medcan's always been medical first, and we've always employed a huge number of physicians and nurses. So we're in the ballpark of 90 physicians and about 85 nurses at this time, and a staff of about 600 out of the Toronto area. But a lot of that is meant to support sponsors on a national scale.
Perfect. Thank you.
Of course.
Okay, and then at this time, we will transition over to Deep.
Perfect. Thank you so much. Alan, would you be able to stop sharing your screen? There we go. Hello, everyone. Just bear with me for a moment. Let's see. Perfect. Okay, so, well, thanks again for making time out of your busy schedules. We do really appreciate it. What I'll do is I will paint a quick picture about Best Doctors Insurance. A lot of you might already know the name, and we'll talk a little bit about the Canadian healthcare challenges, and then we can summarize with a one-pager that we've developed that really does a great job of putting everything on one piece of paper that you will be able to use going forward. So Best Doctors Insurance, as many of you have known, started off as a second opinion service. It is sold with Sun Life benefits, with Great West Life benefits, and so on. But what ended up happening is the second opinion service, at one point, we realized that it was not enough. Because once you receive a second opinion, then you have to act on it. And that's when the company started to change and evolve. So the company has been around for 30 years. We've been in Canada for over a decade. And what we do is we have 17 offices across the globe in different countries solving different healthcare challenges. In Canada, in addition to COVID, two of our main healthcare challenges are medical wait times, in addition to access to medical technology. So if we had to put it in a sentence, it would be, Mr. or Mrs. Client, if access / money / location was not a problem, where in the world would you like to go for your treatment? And typically people would start naming brand name clinics in the United States and sometimes in Europe. And as a Canadian, we just don't have access to that. So as we go forward, we'll watch a 10-second clip that'll paint a picture of the medical wait time issue, and then we'll talk about the medical technology after the fact.
Canadian patients waited 9.3 weeks on average for medical treatment in 1993. But in 2019, they waited 20.9 weeks. This includes the total wait time from when you meet with your doctor and get referred to a specialist to when you receive treatment. Long wait times increase suffering, decrease quality of life, and in the worst cases, can lead to disability or death. To learn more, visit FraserInstitute.org.
So if you can imagine the Canadian healthcare system on a scale of 1 to 10, 1 on the scale signifies, hey, we might have identified a problem. 10 on that scale identifies this person's not going to make it anymore, unfortunately. If you're a 7 or an 8 on the scale, the healthcare system somewhat functions well. If you're a 9 on the scale, it functions phenomenally. The system will suck you in, make sure that you're taken care of, and then you get to go back home. As soon as a serious cancer is identified, the Canadian machine works very well. But what happens if you're a stage 1 cancer? Or what happens if you get into a sports injury that's just not severe enough because the individual is a 40-year-old and not a 65, 70-year-old? So the Canadian healthcare system, as great as it is, has gaps. And these gaps, unfortunately, are experienced by executives who are working and the employees who are working, senior management, technically everyone. But organizations have a vested interest from a bottom line perspective to make sure that the executives, the decision makers really are in their seats working and not navigating the Canadian healthcare system. So if we look at some numbers, GP here just means general practitioner. This is family physician. So from a family physician to treatment, these are the numbers that we saw. Now this is 2019 data. We do have more current numbers, but we were waiting for COVID to sort of work its way through the system before we updated our numbers, because Canada suspended roughly 350,000 surgeries to redirect medical resources to fight COVID, and as they should. So the numbers that we have today are much worse. But this is the quote unquote prior to COVID data. So we'll talk about Alberta, we'll talk about British Columbia, Ontario, Quebec, but the best case here is Ontario, which is 16 weeks. So when we go from general practitioner to appointment with a specialist, that's give or take 2 months back in 2019. Today, it's much worse. From a specialist to treatment, it's another 2 months or so in Ontario. In Alberta, it's another 14 to 16 weeks. So we know now that these numbers are, Alberta's close to 20 plus weeks. Ontario's close to 15 plus weeks. And when we look at specialties, you would hope that something like neurosurgery, which is somewhere halfway down that list, you're not waiting 25 weeks. But today we know that that number is surpassing 32, 33 weeks. Orthopedic surgery is the worst. We have so many Canadians who, when we talk about access to medical technology, sometimes it's not even that. Sometimes it's just, when is it going to be my turn? I've done these webinars across Canada, and we know that folks in Alberta, this came across my screen maybe a couple of months ago. We had an individual who was quoted a timeline of 13 months for a hip replacement. So the Canadian healthcare system, there's not one, as I mentioned, there's 13 different ones. And what does that mean? Basically, in addition to waiting, you're sort of waiting based off of your postal code, because your healthcare system is linked to the postal code that you live in. That's your family physician. Those are the specialists you have access to. Those are the hospitals you have access to. So even though as Canadians we have the right of referral, we're pretty restricted. It's not like the United States when, if you're dealing with an illness, yes, postal code or zip code plays a major role, but they have access to anywhere. They can go anywhere. Here, if you're going from Ontario to Alberta, two different systems. So as I mentioned, these are the 2019 numbers, but this is what the government publishes and says is quote unquote acceptable. They say that if we're making you wait 6 weeks, that's reasonable. Nowhere else in the G7 countries you'll even see this stuff where the government will come out and say that, if we make you wait 8, 9, or 10 weeks, that's reasonable. But we know today that these lines are traveling in very opposite directions, very aggressively, actually. Alberta is not at 16 weeks. We're pushing 22 weeks in Alberta. And then when we look at the entire picture as a Canadian average, that 10.8 weeks is pushing 16 weeks. And orthopedic surgery is something that we're known for, unfortunately. Nationally, we're just known to have the longest orthopedic surgery wait times. If you live in Saskatchewan, for example, a hip replacement, you could be waiting 18 months. So by the time the surgery comes around, people are not worried about medical technology. People are not worried about, can they get a second opinion, or is this the right course of action? Like, the system makes you wait more than a year just to solve a problem. That's why the second opinion product, the best doctors get a second opinion on your health. That's why it's so popular, because it takes us roughly 6 to 8 months to get the first opinion. And if we want to get another opinion on a complex health issue, now you're pushing a year. Whereas the second opinion product is able to provide you a second diagnosis on the illness within 4 weeks. So if we can imagine the Canadian healthcare system and the Canadian insurance, and I was sort of snooping through the attendee list, I did see some benefit specialists that have logged on. So we live in a very reactive environment, the healthcare system as well as the insurance. So healthcare system, that same scale 1 to 10, if you're a 1 or a 2, the system just waits until it's your turn, or until that 1, 2 becomes a 7 or an 8 before the system kicks in to help out. And it's not a fault of the system. It's unfortunately, we're experiencing a bottleneck issue. We suspended 350,000 surgeries. When the recovery plans for hospitals start kicking in across Canada, there's going to be major delays in surgeries and cancer treatments and kidney transplants and so on. That's going to be experienced by individuals like you and I. In addition, the insurance environment is also reactive. Like, a critical illness policy will pay after you're critically ill. As an insurance individual, we go, well, yeah, of course. Why would they pay before? A disability policy will pay after you're disabled. And with that critical illness, you know, the definition of cancer gets thinner every year. You better get cancer how they want you to get cancer if that claim is going to be paid out. And same thing with long-term care, which isn't even sold as a product anymore, but again, reactive. When you can't perform duties of daily living, that's when the benefit kicks in. But is that really helping the employees? So we do have a clear issue from a healthcare system that's reactive to an insurance system that's reactive. So what do we need to solve the issue? We need to shift from reactive to proactive. We need to tackle the issue from all sides: health, wellness, second opinion, and ideally create a product that'll address everything. It'll address the orthopedic surgery, it'll address cancer treatment, it'll address major organ transplants. So the first part is when we address these things, we need to pay for these claims. You know, a second opinion is great, but without money, that's all it is. It's an opinion. Alan did a phenomenal job explaining the annual health assessment. The annual health assessment is a phenomenal tool to have in your pocket because you basically get a scorecard of exactly how healthy or unhealthy you are. And then Medcan helps you work towards a healthier lifestyle. But if there's a surgery or treatment or anything required, and an individual wants to expedite the care, quote unquote, yeah, you can pull some strings, but the system is built in a way where we force everybody to get on public transport. We say, hey, we know you can afford a car, we know you can afford a flight or whatever, but we're gonna need you to get on the bus. That's how the public healthcare system in Canada is set up. So in order to pay for the second opinion and actually act on it, or the annual health assessment, if it was to come back and say, yes, you do need a surgery, we would ideally like some version of insurance that can help you in and out of Canada. We'd like it to be proactive, so it's not, you know, wait until you get stage 4 cancer and then we'll help you. Unfortunately, it's too late. We want to take care of stage 1 cancer. And ideally, we'd like it to be partnered with a company that's going to be around. For example, Lloyd's of London. They've been here for 380 years. They've seen pandemics. They've seen economies go up or down. And their sort of main marketing push is that they've never denied a claim for over 300 years. The second part, the wellness part of this problem, the health assessment. I won't go too much into it as Alan did a phenomenal job explaining exactly what it is. But if you had access to your medical records, a complete picture, head to toe, every 12 or 24 months, where the health assessment is, you know, it's a couple of hours, it's a one-day solution, that's much more comprehensive than what a family physician will typically do. They'll spend 10 to 15 minutes with you. And in order to do this assessment, regardless of where you are in Canada, there are clinics. Well, the presentation is actually not doing a fair job of all of the Medcan affiliated clinics are actually highlighted. And I'm not sure why it's not showing up like this right now, but Toronto, Oakville, Edmonton, Calgary, Vancouver, Halifax, Montreal, and Ottawa, Exec Health, Westmount. These are all Medcan affiliated networks. Part of the Medcan affiliated network, excuse me. So regardless of where the organization is, where the senior management or the employees are, they have access. And part 3, you know, the second opinion. So now you have some version of an insurance that would ideally take care of issues in and out of Canada. You have a health assessment and you have a second opinion. So why is it important to consider this? Well, for individuals, one of the main issues is wait times and access to international medical centers. The initial question that I asked when we got sort of rolling on this on these slides was, if money and access wasn't an issue, where in the world would you like to go for treatment? People typically will say Mayo Clinic, MD Anderson, Johns Hopkins, and so on. Because we do know that there is a brand name when it comes to medical access. Once, like when Barack Obama gets on the screen and says Cleveland Clinic is great, everybody wants to go to Cleveland Clinic if they can afford to. And from a business perspective, of course, attraction tax, but also really reducing the risk for the business. And what kind of risk? It's really tackling risk from all sides. So we went out and we asked a question, knowing that the Canadian healthcare system is in this environment today, knowing that there are challenges with accessing medical technology because sometimes you just wait so long, and waiting is another issue, medical wait times, and that there's no one healthcare system. There's, if you're in BC, the things that you have access to might not be 100% covered in Ontario. And the fact that healthcare systems get impacted so much. So we went out and we asked the question, ideally, what does a Canadian want? And we came down to three things. We want quality. We want some version of a network. And of course, pricing. Even though our survey showed that people are willing to pay more if they get what they pay for. So we went out and we created exactly that. Created a product called Global Medical Care Plus. And ideally, it's a three-part product. It's health assessment, second opinion, and insurance. So now, when somebody gets a second opinion, and the second opinion says, yes, you need to address issue 1, 2, and 3, there's actually money on the table to address those issues. If you go for a health assessment and they say, hey, things are well, but down the road, you're gonna have this problem, there's actually money on the table to address that problem. So we'll take a look at the plan summary in just a moment. But what ideally the product is, it's proactive health insurance. You're not waiting for a stage 4 cancer, because we, Best Doctors Insurance, are in the same boat as the client, rowing in the same direction. But from a business / for the insurance folks in the room, from a business or a loss ratio perspective, we have a vested interest in paying a stage 1 cancer claim instead of a stage 4 cancer claim, because we're on the hook for both. So we much rather identify something that needs attention right away, AKA send all of our members for a health assessment to Medcan every year, making us the only insurance product that has 100% utilization. So every year our members go to Medcan. Every year Medcan says, hey, things are good. Or if they ever say, okay, you need to pay attention to this, there's money in the table to actually pay attention to it and solve the problem. So there are no strict definitions of illnesses. The client decides when they want to address their medical condition, making it the only proactive health insurance in Canada. And then there's a second opinion component as well. Before you pull the trigger, you want to get a second opinion, because now you're not waiting 6 to 8 months for the initial diagnosis. You can wrap everything up in a 4-week period. So when we talk about the plan summary, this is what it looks like. It's a $1, $2, or $5 million policy limit. Excuse me. There's a health assessment component, which is available starting day 1. There's a second opinion component, which is available starting day 1. And there is an EDIS component, which I'll go into in a minute, but that is also available starting day 1. On our group insurance, we have a 24-month pre-existing clause, which basically means starting month 25, we will pay for all pre-existing conditions. We're one of the only ones in the industry to do it. with the financial backing of Lloyd's, where clients are assured that their claims will be paid. So we see often claims come through the pipeline on, month 25, month 27, month 28. And we know that these health issues have been around for a while, and we're okay accepting that risk. So how does it all work? There's roughly 400 of us, and 80 of us are on a pre-certification / patient services team. Allison actually met the head of the patient services team, as did Alan, when they were in Miami. We did a little webinar, seminar. And these 80 individuals, their job is to put together a patient profile when a member wants to use the service, and then submit that profile to whichever hospital or medical center they want to go to, get them accepted as a patient, and book their appointments. On this team, we have doctors, we have nurses, we have people that are on your side that are going to help you navigate the international healthcare world. It's not like Canada where you swipe a health card and the machine functions. So all the way from building a patient profile to you being back home, or your employees / senior management being back home, we have a team that holds your hand the entire way. So, step 1, step 2, step 3, really it starts with an email notification, and it ends with the client paying a deductible. Because a service, and I'll actually go into a PDF right after, a service could be $500,000. If the member's deductible is $5,000, we'd like to get them to pay that right away, so they're out of the picture when it comes to money and funding treatment and anything of that sort. We just let them know if they happen to have $1 million policy, and if they're dealing with an unfortunate health condition where they've racked up $700,000-800,000 worth of benefit, we just let them know, hey, you're almost about to run out of funds. And I never used to believe it, but there are claims over $1 million. We paid a $1.4 million liver transplant case. So this is what the form looks like. It's a little busy, but we're always updating and modifying our forms. But the form basically has the member's information, the broker's information, and their family physician's information. That's it. And they email the form in addition to providing, patient's contact and so on and so forth. And then the team of the 80 individuals, they do the rest. So a little bit about who owns this product. This is a snapshot at currently other employers who have used this product, who are currently using this product, to provide certainty within their organizations. And we also know with COVID, we put out a press release in 2020 saying that we're going to cover all COVID claims. There's no pandemic exclusion. So our business really took off. But it's right. I mean, Lloyd's is okay paying COVID claims, so we're okay paying COVID claims. It's definitely weighted on the group insurance side because you need a minimum of 5 individuals to qualify as a group. And after that, if those individuals are traveling or if they're executives, whatever, they almost never really have to worry about COVID issues, minus their deductible, of course, because we would pay those claims. So everything that I've said, we have a less than a 2-minute video that probably does a better job of explaining it. So I'll play that for you now, and then we'll take a look at the PDF, which I mentioned earlier.
Have you been looking to gain access to the best healthcare centers, doctors, and treatments from around the world as a Canadian resident? Well, look no further than Best Doctors Canada Insurance Services. We provide global health insurance to Canadian families and corporations, enabling everyone to get the best treatment anywhere in the world immediately. How can you use our services? Get access to the best healthcare anywhere in the world. Get an expert medical opinion by a medical specialist. Get an executive health assessment, a complete head-to-toe analysis of your health. For companies, our product is best suited for organizations who want their executives to have access to the best treatment in a timely fashion, so they can return to the work they do best. For families, Our product is best suited for people who want better options than the local healthcare can currently provide. With us, you can enjoy fast and reliable treatment within weeks instead of months when dealing with orthopedic surgeries, cardiac care, cancer care, and care related to complex cases. We even expedite care for sports injuries, which might not qualify as an immediate need within the local healthcare system. Sometimes Canadians can face untimely treatments and not have access to the best medical technology. We ensure your executives and your families can go to the United States, Europe, or anywhere in the world for treatment to resolve these issues. Did you know you can get up to $5 million Canadian of insurance? You can get pre-existing coverage for group clients. You can get travel expenses coverage for group clients. Annual health assessments for primary and secondary insureds at private clinics across Canada. In addition, 100% coverage for conditions like cancer, dialysis, emergency room, outpatient, and more. With us, you get immediate care at world-renowned medical clinics and hospitals anywhere in the world. For more information, contact us today at 1-855-667-4028 or by email at canada@bestdoctorsinsurance.com.
So that's a brief video that basically paints a picture of anywhere in the world, we will pay your claims. We're in the business of paying claims. So before I wrap up the presentation, what I'll do is I will illustrate this sheet here. Just bear with me. We'll go into a full screen mode. So if you can notice, today, as I mentioned, it's a 3-part product. So there's 1, 2, and 3. 1 is what we bring to the table. 2 is outsourced, for example, Medcan and the Medcan affiliate network. 3 is outsourced to the industry leaders that deal with a second opinion. And under the plan summary, there was a heading that says EDIS active day 1. What that means is we provide MRIs and CT scans to all of our members across Canada within 72 hours. And in order to get one of those scans, you could wait over 2-3 months. We're able to do that within a week. So if we could paint a picture, you have insurance to pay for claims. You have an assessment to tell you what areas of your health you need to pay attention to. And you have medical services that'll get you a second opinion, get you MRI or CT scans. In addition, they'll tell you where in the world you can go for treatment. You know, getting $2 million or $5 million is pretty useless if you don't know how to use that money. So we bring advice to the table as well. We say, hey, if you're dealing with one of your kids that have had a sports injury, there's a sports rehab clinic in Arizona, which does a phenomenal job. Perhaps you'd like to go there. If you're dealing with cancer, MD Anderson is known to have the best results for cancer care. Perhaps you'd like to go there. So there's more than just insurance dollars on the table. There's advice, there's health assessment. And our members use the health assessment every year. So even if they're not using the insurance, and hopefully they're not, there's some version and some part of the policy that they use every year. So that's how we convert a reactive health insurance / healthcare system into a proactive environment where we put money on the table, we put a health assessment on the table, and we put advice on the table. And we let the client make the decision how they would like to use it. And just to illustrate what a typical cost could look like, whoops. In the last, I'll just zoom in. In the last 2 years, these are some of the bigger claims we've paid. Of course, the smaller claims are almost always orthopedic surgeries. The hip, the knee, the sports injury, and shoulders, and so on and so forth. But these are some of the bigger ticket items. with that, I will wrap up. And if there are any questions, I will take them now.
Thanks, Steve. We'll just give all our participants a minute here where if they do have any questions, they can type it in the Q&A box. But just while we're waiting for that, I do want to thank everyone for joining us today, as well as our two guest speakers. I think access to healthcare has always been an issue in Canada, but COVID has actually made that worse. And I think organizations, there are things that companies and organizations can do to help protect themselves from that, especially for key individuals within that organization, where you don't want to be in a situation where you've got executives and leaders that can't get access to care and potentially even go on disability when there are solutions and options out there for them. So I don't see any questions, but if anything does come up for any of our participants after the session, feel free to reach out to your local Leslie Group consultant, and we'd be happy to source that out. Oh, here we go. So we just had a question come in. Do you have a list of all the medical, excuse me, do you have a list of all the medical clinics and physicians which are approved for use? If there isn't one approved for use, is this off the table?
So that's a great question. And I might have not mentioned earlier, we're a non-restrictive product. So we will never tell you that you cannot go to clinic A and you should only go to clinic B, or there's a discounting available, therefore we'd like to direct traffic to one clinic versus another. It's almost where we literally let the client make the decision from a liability perspective, but really from an empowerment perspective. So we'll never say that these are the list of approved clinics slash physicians that you can choose from. That's why the medical services part of the product actually recommends 3 or 4 clinics that they can go to. And if they choose not to go there and go somewhere else, that's fine.
Perfect. Thanks, Deep.
No problem.
Okay, so we're just coming up to noon Ontario time, or on the hour, depending on what province you've joined us for. So we'll wrap up here. But again, a huge thank you to everyone that was able to join us today, and stay healthy, stay safe.
Thank you very much, everyone.
Thank you so much for your time.